I had a very interesting client, and she was treated several times. I want to say 8 to 12, you know, and that's highly unusual for the way that I work with patients. I usually see them 3 times. Well, this patient explained that she did some yoga exercise and she felt something shift and yada, yada, yada. And she swore that that made her pelvis uneven. Well, I did everything I knew to do with the pelvis to restore normal spring mobility. And, you know, I was trying to work with her to kind of say, you got to make friends with this, you know. Our bodies get injured and then we feel like they're asymmetrical because we're interpreting the nociception, blah, 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 blah. She wouldn't have anything to do with that. She said, you are the only one that can figure this out. And I'm like, okay, pressure's on. And, you know, I could tell she just she was not drinking my Kool-Aid, you know, about making friends with her body, etc. Okay. So I did retest something that I had tested prior, but never encountered a restriction. And that is to spring obliquely on the sacrum and obliquely on the ischium. Okay, so remember the sacrum tapers top to bottom. Okay, so I contacted her sacrum this way. My arm was parallel to the treatment table. She's on her stomach, and I tried to load it and it wouldn't load and it wouldn't spring. So for treatment, I just, you know, kept the pressure on it, probably 15 pounds of force, and I sustained that for 3 minutes, and voila, I could then get spring and recoil. The recoil is so important. Then I came and tested ischium, could not get any oblique spring, and so I loaded it and sustained that pressure for 3 minutes. After that, I could load it and spring it. So that's an oblique twisting pattern, you know, oblique rotational twisting pattern of sacrum and lower pelvis. And so I have N equals 1. I have only one experience, but I felt compelled to share that with you. And should you ever encounter it, I'd be so grateful for your feedback. And the other question on all of these patterns is to ask, what are the relationships of ligament tone, particularly sacrospinous, and then through the, sacrotuberous, and then you have to palpate lateral to the border and palpate through that ligament to spring the sacrospinous ligament that sits at this kind of an angle. Okay, so I invite you to keep in touch with me for any questions and for any contributions. And if you can spread the word, I'd be so grateful to you. Thank you very much.